Dissociative amnesia is what I'm talking about today. Not a common diagnosis, but a pretty serious one. I'm going through a series called Demystifying the DSM, the diagnostic book that we use in psychiatry and psychology to diagnose mental health conditions. I'm Cristi Bundukamara, Dr. B. I'm a psychiatric nurse practitioner with over 20 years of clinical experience and a lot of personal experience. Not specifically with dissociative amnesia, but with trauma and grief. But I have had experience as a professional working with dissociative amnesia. So what is that? Dissociative is kind of meaning that it is a clinical response to stress. So this oftentimes happens after some sort of trauma. But it could happen with normal stress, kind of getting to that point of feeling overwhelmed. So amnesia means we forget something. This is outside of normal forgetfulness. We can all get so overwhelmed that we lose our keys, or we forget to pick up our kids from school, or but we're not actually losing time. Okay, so amnesia is like you're losing actual time. It can be localized, so you lose a period of time, maybe a 1 month period of time that you cannot remember anything, or it could be selective to the specific event. Oftentimes, the trauma itself, there is a selective amnesia, forgetfulness, not normal forgetfulness, right? Like this is an actual block. Or it could be generalized, meaning like you forget who you are or your history, where you come from. You forget a person in your history. Okay, so dissociative amnesia means that it's not from a clinical reason, like a medical reason, and you are forgetting a period of time, like it's lost as a dissociative or maladaptive response to that stress. So as we're going through demystifying the DSM, I always talk about there's always several criteria that need to be met in order to have a diagnosis of dissociative amnesia. And we're in the dissociative chapter. So I talked about what is dissociative amnesia. So that is basically criteria A, that something has happened or there is a period of time, either localized, selective, or you're forgetting who you are, or something very specific around your history. And oftentimes this is isolated, okay? So we're not talking about the chronically mentally ill person who doesn't remember their teen years, or that's more of a neurocognitive decline based on the diagnosis. Dissociative amnesia is oftentimes associated with trauma, so it could be in addition to PTSD, okay? If it's dissociative amnesia, if it's some dissociations, that is part of the criteria of PTSD. But this is kind of a more intense separation from reality, like almost like a block, okay? So that's criteria A. You are having an episode or a period of time of amnesia, and it is a stress response. So criteria B is that it's causing some clinically significant distress. And this is important in all DSMs because oftentimes I will be talking to someone and they will tell me, I know that I was molested when I was a child by my father, but I don't have any memory of it, okay? That is a block. It is amnesia, a maladaptive coping, but as they work through it in therapy, they're able to start bringing it up and talk about some of the things around that. So it's not a true amnesia, it's more of a block, right? So is this causing some clinically significant distress? The amnesia, right? Criteria C is it's not associated with substances, right? Anybody who is self-medicating or trying to stuff their feelings and their pain and their trauma with illegal substances or even legal substances, alcohol, cannabis is legal in most states. If you are using that to suppress these memories, that is not dissociative amnesia. That it's not associated with a neurological condition, including a brain injury. We have medical amnesia. There are medical neurological reasons why areas of the brain are becoming damaged and it is impacting memory. Okay, so we see this in dementia patients. They will have periods of time where they have localized and selective amnesia. Sometimes in severe cases, they don't remember who they are or who their family is, right? So they are experiencing amnesia, but it's amnesia for medical reasons. Dissociative amnesia is about this maladaptive stress response, like whatever this was, it was too much for my mental health, and this is how my body is responding. We don't have a choice in this, it's just how our body's responding. And it's not associated with seizures, okay? Seizures often cause lapses of amnesia, again, a medical reason. So criteria C is that it's not associated with a medical reason. So if you have somebody coming in, or if I have someone coming in and their first complaint is this amnesia. They're not telling me about depression. They're not telling me about anxiety. They are denying trauma, right? I need to make sure that I am working this up from a neurological standpoint before I go down the mental health route, okay? So criteria C is that it's not associated with a medical reason. And criteria D is that it's not associated with dissociative identity disorder, which I have a whole nother video on that you should watch. It's not associated with a somatic disorder, and it's not related to neurocognitive, meaning it's not related to the fact that they have a low IQ or that they are slow or just, have a hard time processing and remembering things. So that is the criteria for dissociative amnesia, a DSM dissociative disorder. There is also kind of a sub of this that's called dissociative fugue. It makes for good movies. I've only seen it twice, and it's when I was working in inpatient psychiatry, because oftentimes they end up in the mental health ward not knowing who they are. So they're considered a Jane Doe or a John Doe, and we are trying to figure out who they are and treat this dissociative fugue. So the dissociative fugue is, there's apparently some purposeful travel. They will get on a plane, go, to a completely new location where they know nobody. Whether this is conscious or unconscious is questionable, but it's not important as far as diagnosing and treating, okay? So somebody shows up clinically in the hospital and they don't know who they are, where they came from. We're going to work that up medically first, and then we're going to, diagnose with that dissociative fugue and hopefully find out who they are. Many times, the two patients that I've had over the course of 20 years of clinical experience, they were actually in the hospital for several months and being treated with antipsychotic medication to bring them out of this dissociative fugue. And then they began, with counseling, began to really, start to bring some of those memories back. But oftentimes that's because we found the family, comes and visits, and we start that kind of reintegration into reality. It is not always treated with antipsychotics. And I can tell you that's probably because these were severe cases. They were in an inpatient psychiatric facility. Typically, this is mostly counseling, reintegration, finding someone, if they've forgotten their identity, finding someone that they do know, and starting that reintegration. If it is localized or selective around a trauma, we're treating it as an additional symptom of PTSD. So we have to treat that PTSD, and the dissociative amnesia should improve. So go back and look at the video on what we do for PTSD, and that's how we would treat this dissociative amnesia, in kind of that outpatient setting. So there's not a specific medication. It is kind of finding that root cause of what's going on and what has caused this, and treating that, okay? And there's got to be some what we call reintegration therapy, like we're trying to bring this person back into reality if it's appropriate. Now remember, criteria B, clinically significant distress. Not every person who has experienced trauma needs or wants to go back and bring up and process that trauma correctly. I will tell you that oftentimes there's a cumulative effect, and you will begin to have symptoms of depression, anxiety that, oftentimes, if not dealt with, will come up in physical symptoms, right? Our body, we are both mental and physical beings. We hold these emotions, these experiences in our body. And if someone's response to a stressor, whether it's severe trauma or, a life stressor, is dissociative amnesia, they are getting to the point where physical symptoms, amnesia is a physical symptom, are manifesting. Okay, so we absolutely do need to treat it, but kind of finding that underlying cause. Sometimes we'll use antidepressants. That is the, kind of the first line treatment for anxiety and PTSD, trying to get that neurotransmission up so that we can function better. So that's dissociative amnesia. Keep following me for my series on demystifying the DSM, because I believe that we all are mentally strong. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.